Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, and here's all that you need to know about COVID-19 on Friday, the 8th of May. First up, a look at the numbers. There are now 56,302 cases across the country. The number of people who have died are 1,813. That's more than 100 deaths in just the last 24 hours. And according to All India Institute of Medical Sciences Director Randeep Guleria, who also serves in the empowered group that has been formed by the government to tackle COVID-19, Dr. Guleria says that the peak of this disease in India is yet to come. In fact, according to the mathematical models that he and other scientists are working at, it will be any time between now and August. So if you think the lockdown, with it ending on the 17th of May, that things are going to get easier, perhaps the need for us to be more careful just increases. What we've also seen, according to him, in just the last 3 days, the number of critical care, those patients who need ventilator and other critical care support, that number has shot up as well in the last 3 days. The numbers, actual numbers are still small, but relatively they have shot up in the last 3 days. So this is something to really keep in mind as we go towards a graded exit from the lockdown. The second story that we have for you is something that is an affirmation of what many people believe, that at the end of the pandemic and these lockdown days, we may see a baby boom. Now, UNICEF has said that India is going to lead that baby boom. Across the world, after 9 months from now, we are going to see an estimated 116 million babies. Now, India is topping that list with 20 million births 9 months from now. And they're saying that the restricted access to birth control may be a reason for this. There are other countries as well, which are China, Nigeria, Pakistan, but it's not just the developing countries, but also US is going to see a record number of births post the pandemic, being born in the shadow of COVID-19. Well, another policy that the Union Health Ministry has come up with is that those who have mild symptoms, patients of COVID-19, can now stay in hotels. Not just hotels, they can also stay in service apartments and other kind of private lodges and facilities. They have issued a standard operating procedure for this. One of the procedures says that the facility will have to have a doctor and a nurse 24/7 on call who will monitor those patients who have hired these paid facilities in order to say. Already, hotels are being used as quarantine facilities for all of those Indians who are now being evacuated from across the world and being brought, and this process started on Thursday. So if the danger of COVID-19 is on till August, how will children go to school? Well, the Union HRD Ministry is now proposing that they will start 12 direct-to-home channels. Their philosophy is one channel, one class, which means that there will be a separate channel for class 1, separate channel for class 5, so on and so forth. And this, they hope, will counter what many feel is the unequal access to internet. Governments like Delhi government have been trying to conduct their classes through SMS and texting facility, but the union government is hoping that this channel, and they're hoping to tap all resources of UGC and NCRT in order to find study materials which will then be beamed on these free-to-air channels. Well, if you think llamas are cute, well, here's another reason to love them. American researchers are now studying the antibodies in a 4-year-old llama called Winter. They're following up actually a 2016 study which found that the llama had antibodies which could counter and totally neutralize the impact of the COVID-19 protein. Well, here's the llamas, and that's all the news for now. Keep tracking them on HindustanTimes.com.